Welcome. This video focuses on the MST fit circle. By the end of this video, hopefully you will understand how to properly do a fit circle and be able to articulate different areas of that circle. You may be wondering, what is a fit circle? It is looking at a target behavior and finding specific examples, drivers, for why the behavior is happening. When we do this, we are able to understand primary drivers that the MST therapist will look at more closely. Let's take a closer look at the fit itself and show you how to set it up. When creating a fit, we want to identify the target behavior. This behavior could range from a behavior that is part of the referral or one that arises through the therapeutic process. When creating a fit, draw a circle with the target behavior inside of that circle. Then, on the outside, you will point arrows or lines coming from what we call drivers, or things causing the target behavior to happen. For it to be a target behavior that we want to know more about, there should be two or more drivers causing this target behavior to occur. Let's look at what makes a good driver. 1. The driver should describe behaviors and facts. When deciding on whether or not a behavior fits as a driver, you can rule out ones that are based on feeling or thinking. Really focus on acting drivers. We want to know who did what that contributed to the targeted behavior. 2. Is it directly related to the problem? Reread it and make sure it is clearly contributing to the problem. 3. Be specific. A good driver should be specific. Reread it and see if it needs any clarity. 4. Don't focus on the child's bad behavior. We do not have the power to directly change your child's thoughts or feelings, but we do have the power to change your actions as the parent. 5. Word choice is less important than meaning. It's okay if drivers are wordy, but make sure they capture the real truth behind what was really going on. Understanding a meaningful driver is more important than the words you use. Now that we know what makes a good driver, let's look at 4 possible types of drivers. 1. Direct. These are obvious things that contribute to the situation. An example being, your child did something that was a direct driver to you having a reaction to it. 2. Missing. Things that were not present in the situation, but could have helped the situation be better if they had been there. These are often referred to as the lack of something. What could have helped stop the situation from happening this way? Could be a lack of supervision or monitoring, or a lack of effective consequences. 3. History. These are things that have been true for a long time. They are a normal part of life. An example could be that a parent has a history of substance abuse. That may become a driver which contributes to a child's substance abuse. 4. Lack of a plan. This driver is often hard to see, but is important and easy to work on. How to tell if this driver is present? Ask if the parent has ever felt powerless in a situation and did not know what to do. We can take the time to plan ahead so the parent or guardian will know what to do in the future. Let's look at an example and make this a bit more realistic. Our target behavior in this fit circle is going to be child's substance use. This is a behavior we want to find more about and what could potentially be causing it to happen. Drivers for this target behavior could be as follows: having peers who use, lack of a plan to decrease use, lack of supervision and monitoring, easy access to substance. In conclusion, understand that your first time doing a fit circle will be confusing, but this is when your MST therapist will help clarify and clear up drivers as well as the target behavior they wish to discuss. Remember that you are with your child the majority of the time. Any driver you can give the MST therapist is more helpful than not having any. They can help you hone in on this process more as the treatment moves forward. You're doing great. Don't give up.